So in here we will be talking about the corrugator supercilii muscle. We can also call it as a muscle of eyelid and the orbital opening. You can see very clearly it is covering the orbit. So we are going to talk about the origin, insertion, nerve supply of it. So if we talk about the origin of corrugator supercilii, it is coming from the medial end of superciliary arch. Okay, very clearly you can see in the image. And if we talk about the insertion is on the eyebrow from the skin of mid eyebrow. Okay, it is inserted here. And if we talk about the nerve supply, it is coming from the temporal branch of facial nerve. One of the branch of facial nerve is temporal. Action, the vertical lines in forehead as we do it in pruning. That is the action of it. So we are going to talk about the procerus muscle. This can be also called the muscle around the nasal opening. That means it is covering the nose area mostly. We are going to talk about the origin, insertion. If you talk about origin, it is originating from the nasal bone and also from the upper part of lateral nasal cartilages. And if you talk about the insertion, it is inserted on the skin of forehead, between eyebrows, and also on the bridge of nose. And talking about the nerve supply, temporal branch of facial nerve is supplying the procerus muscle. Action, it causes transverse wrinkles. Okay, transverse wrinkle is caused by it. Thank you. So we are going to talk about the compressor nares muscle. This is also along with processor is the muscle of nasal opening, we can say. Okay. So what actually as a word suggests, compressor, so it's going to compress the nasal opening also. If we talk about the origin, it is coming from the maxilla, just lateral to nose, as you can see. Talking about the insertion, it is inserted on the aponeurosis across dorsum of nose. There are cartilages above it. There is aponeurosis and it is inserted on it. Talking about the nerve supply, it is supplied by the buccal branch of facial nerve. Action, it compresses nasal aperture as it is compressor nares. So we are talking about the dilator nares muscle. We can call this muscle around the nasal opening also. So we are talking about the origin, insertion and nerve supply. So it is originating from the maxilla over the lateral incisor. Talking about the insertion, it is inserted on the alar cartilage of nose, no bony insertion. Talking about the nerve supply, it is supplied by buccal branch of facial nerve. And what's its function? It dilates the nasal aperture. We are talking about the depressor septae muscle. This is also the muscle around the nasal opening along with procerus, compressor nares, dilator nares. So this is the muscle around the nasal opening. Talking about the origin, it is coming from the maxilla over the medial incisor. You can see in the image. Talking about the insertion, it is inserted at the lower mobile part of the nasal septum. Talking about the nerve supply, it is supplied by buccal branch of facial nerve and its action is to pull the nose inferiorly. So we are talking about the levator labii superioris muscle. As you can see, we are going to talk about the origin, insertion, nerve supply and action. So this is the muscle around the lips, you can see. So talking about the origin, it is originating from the infraorbital margin of maxilla. It is inserted on the skin of upper lip. So there is no bony insertion. It is inserted on the skin of upper lateral half of upper lip. Talking about the nerve supply, it is supplied by zygomatic and buccal branch of facial nerve. Its action is that it elevates upper lip and also form nasolabial groove. Thank you for watching. We are talking about the zygomaticus minor muscle. This is the muscle around the lips. So we are going to talk about the origin, insertion, nerve supply and action. So talking about the origin, it is coming from the zygomatic bone. So from the lateral surface of zygomatic bone, it is originating. Talking about the insertion, it is inserted on the upper lip medial to its angle. Okay, on the upper lip. Nerve supply as similar zygomatic and buccal branch of facial nerve. And its action is to elevate its upper lip. So here is another muscle in the series of the muscles of the lip, levator angulae oris muscle. We are going to talk about the insertion, origin, nerve supply and action of this muscle. So talking about the origin, it is coming from the maxilla just below the infraorbital foramen. Talking about the insertion, it is inserted on the skin of angle of mouth. So no bony insertion here also, just the insertion on skin. Supplied by the facial nerve, but the buccal branch of facial nerve supplies this muscle. Its action is that it elevates angle of mouth and also form nasolabial groove. Thank you for watching. So we are going to talk about the depressor angulae oris muscle. This is the muscle around the lips, as we have been going through the series. So this is the muscle around the lip, depressor angulae oris muscle. We are going to talk about the origin, insertion, nerve supply. Talking about the origin, it is coming from the oblique line of mandible just below the molar, premolar and canine teeth. Talking about the insertion, it is inserted at the skin at the angle of mouth. It is supplied by mandibular branch of facial nerve. And its action is to draw the angle of mouth downward and laterally. Thank you for watching. We are going to talk about the depressor labii inferioris muscle. This is the muscle around the lips. So we are going to talk about the origin, insertion, nerve supply and action. Talking about the origin, it is coming from the mandible, but the anterior part of the oblique line of mandible. insertion, it is inserted at the lower lip at the midline. It is applied by facial nerve, but the mandibular branch of facial nerve. And its action is to draw lower lip downward. So it draws the lower lip downward. Thank you. So we are talking about the mandibular muscle. We can call this muscle around the mouth. So we are going to discuss about the origin, insertion, nerve supply and action of mandibular muscle. Talking about the origin, it is coming from the mandible, just inferior to incisor teeth. And talking about the insertion, it is inserted at the skin of chin. It is supplied by facial nerve by the mandibular branch of facial nerve. It elevates and protrudes lower lip as it wrinkles skin on chip. So its action is this.